My name is Nancy Pasquale, and I am the co-founder and coalition coordinator of RIAC. I'm joined today by Daniel, Madeline, and Matthew, members of the RIAC Youth Action Team. RIAC started in 2014 when a group of parents and community leaders came together around a shared concern about youth substance use in Rye. We sought guidance from prevention leaders in neighboring communities and began gathering data to better understand the nature of the issue so that we could bring community partners together to begin to address it. Since our inception, we have partnered with the Iona College Center for Social Research and the Montana State University Center for Health and Safety Culture to review and analyze data to inform and evaluate our ongoing work. Our prevention efforts are funded by the White House Office of National Drug Control Policy through a federal grant of the Drug-Free Communities, or DFC, support program. After a one-year DFC mentor grant under the guidance of our partners at the Westchester Coalition for Drug and Alcohol-Free Youth, RIAC was awarded an independent 5-year DFC grant in September of 2016, with the Rye YMCA as our fiscal agent, overseeing the management of grant activities. Early in 2017, we forged a relationship with the Institute for Behavior and Health, a national research and policy organization in the Washington, D.C. area. And together we co-founded One Choice Prevention. Based on the science of the developing brain and nearly 50 years of research in the field of substance use, One Choice is based on 3 key principles that have become the foundation of RIAC's prevention work locally. The first, that addiction is a preventable pediatric onset disease, and the developing brain is uniquely vulnerable to substance use. The second, youth substance use is dominated by 3 main drugs: alcohol, marijuana, and nicotine. And for youth, the use of any one of those drugs is closely associated with an increased use of the other 2, as well as the use of other drugs. So for youth, all drug use is connected. And 3, contrary to the popular notion that all teens use substances, national data are clear. There are a growing number of youth making the healthy choice, one choice, not to use any substances. Our local data aligns with this national trend, and we have woven One Choice into every aspect of our prevention strategy since our very first year of DFC funding. The presentation that follows demonstrates the progress that we have made in our first 5-year grant period from 2016 to 2021. As a result of that progress, I'm happy to report that RIAC's DFC grant funding was renewed for a second 5-year period, beginning in September 2021. In all, this represents $1.25 million in federal funding to support our local prevention efforts over that 10 years, spanning from 2016 and going into the future through 2026. The Drug-Free Communities program has 2 goals: to establish and strengthen collaboration across all sectors of the community in order to reduce youth substance use over time. Research shows that in order to effectively reduce youth substance use, coalitions must engage all sectors of the community. And our work is not possible without the dedication and commitment of our community sector partners, who you will see highlighted throughout the presentation. Together, we show up for prevention. And as we embark on the next 5 years of our Drug-Free Communities funding, we challenge you to think about your role. How will you join us? How will you show up for prevention? Daniel will get us started by sharing some data about our first substance of focus and the one that has our highest prevalence of youth use: alcohol.
Since our first RIAC survey in 2014, we've seen reductions in the past 30-day alcohol use across all grades. This general downward trend has already started in several grades before the COVID-19 pandemic began. And in 2021, we see very low use rates in 7th to 8th grades, with 8th grade at 4.4%, now well below 8th grade use rates nationally. We also see a substantial reduction in 9th grade past month alcohol use. Although there were dramatic reductions in alcohol use from 2014 to 2021 in grades 10 through 12, these numbers are still cause for concern. At 30.3% in 10th grade and 53.4% in 12th grade, past 30-day alcohol use among older high school students remains significantly higher than our peers nationally. Similarly, in spite of reductions in binge drinking for all grades from 2014 to 2021, binge drinking rates, say in 9th through 12th grade, are higher than peers nationally. Binge drinking is consuming 5 or more drinks in a single sitting and is particularly dangerous, often associated with alcohol poisoning and other risky behaviors.
As Daniel noted, we have far fewer 7th through 9th graders reporting past month alcohol use in 2021 compared with 2014. These data suggest something that we call delayed initiation. This is an important concept in prevention because of that unique vulnerability of the adolescent brain. The younger a person is when they begin using substances, the greater the likelihood that they will develop a substance use disorder later as an adult. I also draw your attention to our high past month alcohol use rates in grades 10 through 12. They are cause for ongoing focus and concern, in spite of the fact that we've seen reductions. We specifically also see a slightly higher incidence of alcohol use by those identifying as female versus those identifying as male. Part of what contributes to our numbers overall is a pervasive normalization of underage drinking. The misperception that everyone's doing it and it's just a little beer are commonly held beliefs, both nationally and here locally. Here in Rye, we see these beliefs reflected in the significant disconnect between perceived use of alcohol at 82.8% and actual use at 49.3% among high school teens. Even before the pandemic, the majority of teens reported using alcohol either at home or at a friend's house. Pandemic-related family togetherness increased parental supervision, limiting access to alcohol at home. COVID-19 related restrictions also resulted in fewer and smaller of what we call house parties, limiting access to alcohol at a friend's house. The challenge for us as a community is to think about how we can hold on to these reductions even as we emerge from the pandemic. One of the lessons the pandemic has shown us is that limiting access to alcohol at home, whether our homes or friends and neighbors' homes, is a useful and effective strategy for reducing underage drinking. Another change during the pandemic was easing of certain alcohol and beverage control policies that created a sharp increase in at-home delivery and allowed for things like to-go cocktails with food orders. If these changes remain in place in the long term, they will add a new dimension to the prevention picture in terms of that important risk factor of ease of access. So how do we collaborate across all sectors of the community? First, it's important to note that we do have a low incidence of citations for serving minors for our local businesses and restaurants. But when to-go delivery and mask mandates made it more difficult to ID, our local restaurants stepped up and worked with their servers to change practices to ensure adult pickup of alcohol with orders. The Rye PD works with county and state law enforcement and with the schools to increase staffing and patrols during historically high-use times. These include things like the Rye Harrison game, Thanksgiving, winter holidays, including New Year's Eve, Super Bowl, prom weekends, and graduation, among others. As part of our national involvement with One Choice, our youth leaders have gotten involved, creating PSA videos, presentations, peer message campaigns, and education materials for both adults and youth. In response to the COVID-19 lockdown, RIACT collaborated with other coalitions across the county to create the No to Prevent virtual speaker series, bringing nationally renowned speakers on a variety of prevention and parenting related topics right to the comfort of people's living rooms. Due to the success of the program in 2020-21, This collaboration continued in the 21-22 school year, and we are already planning for 2022-23. You can check out recordings of past speakers and register for free for future speakers at no2prevent.org. And as you begin to contemplate what you can do to help, you should know that we have a myriad of resources to help you. We'll be directing you how to find them a bit later on, but some of those tools include our Parenting for Prevention 101, SAMHSA's Talk They Hear You series, and our One Choice Primer for parents and caring adults.
So, how will you show up for prevention? If you're a parent or caregiver, talk to your kids about the risk of underage drinking. Start talking early before use starts. Remember that prevention is not a single conversation, so talk often. And establish clear expectations about no use of any substances as the best way to protect their health and developing brain. The tools and resources on our RIACT website can help you with those conversations. And even though it may sometimes feel like your kids aren't listening, you should know that we hear you. Research shows that teens whose parents set clear rules are less likely to drink than their friends with parents who don't. So, monitor the alcohol in your home and don't provide alcohol to teens. You can make a difference for your own kids and for their peers by reducing access to alcohol in your house. Reduced access equals reduced use. And if you've ever thought it's just a little beer, you should check out our national One Choice campaign resources to learn more about the connection between youth alcohol use and the use of other drugs. Teachers, coaches, club advisors, and other caring adults, we need you to show up for prevention too. Be a safe adult. Connection to caring adults at school and in the community is a powerful protective factor against for many behavioral risks for youth. Learn to recognize the signs of an emerging substance use or mental health challenge and connect with teens with professionals who can help. And please remember, what you say and do matters. Let us know that you care by setting clear expectations of no use for our teams, clubs, and youth groups, and provide positive reinforcement when we make healthy choices not to use substances.
Now let's turn our attention to Madeline, who will walk us through the data on our second substance of focus, marijuana.
In the period from 2014 to 2021, we have seen some ups and downs in marijuana use rates, partially in response to the national debate over marijuana legalization, with many states legalizing marijuana, often first for medical use, and then for adult non-medical use. We know that when drugs are legal, such as alcohol, nicotine, and now marijuana, they are easier to access, and increased access is associated with increased use, including increased youth use. In spite of the changing picture with marijuana legalization, here in Rye, we have managed to see some reductions in youth marijuana use across grades 7 through 11 in 2021. Although past month use rates in grades 7 and 8 are quite low compared to 2014, both grades show small increases since our 2018 survey. 8th grade at 1.5% and 10th grade at 11% are both below past 30-day use rates nationally. In 12th grade, although rates are similar to 2014, we see a dramatic increase in past 30-day marijuana use compared with our 2018 survey, with more than 1/3 of seniors reporting use, a rate significantly higher than national peers.
Even before the New York State Legislature voted to legalize marijuana for adult non-medical use in March 2021, the ongoing debate around legalization here and across the country have contributed to decreased perception of harm and the normalization of use. Both of these conditions are associated with increased youth use rates. Understanding the role marijuana has historically played in the war on drugs and the disproportionate incarceration of people of color, RIAC joined other New York State coalitions in advocating for decriminalization, not legalization, because of the negative public health impacts associated with increased access and commercialization, particularly for youth. There is a significant disconnect between perceived use at 74.5% and actual marijuana use at 24% among high schoolers. This perception gap also exists for the perceived use at 69.5% versus actual use at 17.7% of marijuana edibles. During the pandemic, 12th grade past month use increased by 1/3 and is well above national use rates. A small increase also happened from 2018 to 2021 for grades 7 and 8, also warranting careful attention within the context of living in a legal state, where we expect availability and access to skyrocket in the coming years. Also of concern, New York State regulation allows for up to 12 marijuana plants to be grown in homes. As has historically been the case with alcohol, we expect to begin to see an increase in access at home or at a friend's house for marijuana as well in the coming years as a result. As such, education about the risks for youth and monitoring and limiting access in the home will be important areas of focus for the coalition going forward. Following legalization, local governments, including our Rye City Council, had the opportunity to consider options to mitigate access through policy at the local level. Speaking at public hearings and responding in writing, parents and youth leaders alike shared information with local policy members about the public health impact of marijuana legalization for youth use. In May 2021, the City Council strengthened and expanded existing laws to prohibit smoking and vaping of marijuana and also nicotine in city-owned public spaces such as our recreation parks, the Village Green, the Nature Center, and others. This was followed in September 2021, when the City Council voted to opt out of marijuana retail shops and on-site consumption, cafes, and lounges here in Rye. Data from already legal states such as Colorado and Washington suggest that there is an increase in youth use within a 4-mile radius of retail marijuana locations. So opting out is a significant step toward protecting youth. Several neighboring communities also voted to opt out of retail marijuana, further expanding the reach of that safety net. But the challenge before us remains as we contemplate strategies for reducing youth marijuana use in a now legal state. In response to this challenge, the collective of local coalitions behind No to Prevent created a website and social media campaign, Know for Yourself, to help educate community members and policymakers about the impact of legalization on youth.
How will you show up for prevention? You can be a resource for accurate information. The commercialization of marijuana use has caused many youth and adults to believe that everyone uses. The truth is, 76% of Rye high schoolers have not used marijuana in the past year. Teens are more likely to use substances when they believe, well, everyone else is doing it, so correcting this misperception is important. The high-potency THC marijuana products available today are different from the pot you may remember from the 70s, 80s, and 90s. You can visit our website, knowforyourself.org, to learn more about the risks of youth marijuana use. Just like with alcohol, when it comes to youth use, all drug use is connected. National research shows teens who used marijuana in the past month are 9.9 times more likely to use illicit drugs than their peers who didn't. Check out our One Choice materials online to learn more. And remember to start those prevention conversations early and talk often. If you need some tips for how to start the conversation, you'll find clickable links to resources like the Partnership to End Addiction's Marijuana Talk Kit for Parents. Talk. We're listening, and what you say matters.
Matthew will be sharing some information about our third substance of focus, nicotine, specifically E-Cig use and vaping.
Prior to 2016, survey instruments captured information about youth nicotine use by asking questions specifically about cigarettes and smokeless tobacco. But in the middle of the 2010s, vape devices like Juul exploded onto the market with slick, easy to conceal packaging and flavored liquids that were attractive to tweens and teens. This phenomenon quickly began to undo decades of public health victories in reducing nicotine use and escalated in 2019 when the US Surgeon General declared youth vaping an epidemic. You can see skyrocketing rates of youth vaping of nicotine in our 2016 and 2018 survey results, with dramatic increases in most grades. Our 10th and 12th grade past 30-day vaping of nicotine was significantly higher than peers national, nearly double the national averages in 12th grade in 2018. Thanks to tremendous advocacy and education efforts, we have cut nicotine vaping numbers nearly in half in almost all grades, with the past month nicotine vaping down below national averages in 12th grade at 25.7%, and significantly below peers nationally in 8th and 10th grades.
As Matthew described, aggressive marketing of e-liquids in flavors attractive to kids like mango and cotton candy contributed to a phenomenon that we began to refer to as the flavor trap. E-cigs were also initially promoted as being safer than combustible cigarettes and often misrepresented as an option to help adults quit smoking. This was all done in spite of any lack of evidence of their effectiveness as a smoking cessation device, and we now know that e-cigs turned out to carry other health risks of their own. This misinformation contributed to general low perception of risk early on. Tobacco 21 legislation took effect in 2019, raising the age to purchase all tobacco products, including e-cigs and vape devices, from 18 to 21. Again, aiming at that reducing access as an important strategy. And eventually, under tremendous pressure from public health and prevention advocates, New York state legislation banning the sale of flavored e-liquids went into effect in May 2020. These policy strategies helped contribute to the decrease in youth use we see in the 2021 survey data. RIACT Youth Action Team members were on the front lines of effecting those policy changes, joining forces with teens across the county for press conferences and providing testimony before the County Board of Legislators on multiple occasions. School Superintendent Dr. Byrne worked with the coalition and provided testimony before a New York State Senate panel to educate policymakers on the impact of e-cigs and vaping on youth, and particularly the burden in schools. RIACT partnered with both the Rye City Schools and Rye Country Day to disseminate information about the risks of nicotine vaping and to educate parents, teens, and school faculty and staff about vaping and e-cigs. And our RIACT Youth Action Team created a Shatter the Myths campaign to educate peers about the risks of substance use, including vaping nicotine. Originally planned for National Drug and Alcohol Facts Week in March of 2020, the campaign was postponed because of the shift to online school during the COVID lockdown. But thankfully, it was successfully launched in Rye Middle School and Rye High School as part of the return to hybrid school in fall of 2020. These efforts contribute to the decreases that you see in the 2021 data compared to 2016 and 2018 data.
How will you show up for prevention? On the RIACT website, you can find our vaping flyer, which has information about the risks of vaping and nicotine use for young people. Know the signs of use and connect young people in your life with help to quit. Like alcohol and marijuana, youth use of nicotine is strongly connected to the use of other drugs. Teens who use nicotine in the past month are 8 times more likely to use illicit drugs than their peers who didn't use nicotine. 90% of all adults with a substance use disorder started using nicotine, marijuana, or alcohol before the age of 18. Check out our One Choice prevention materials for parents and caring adults. Prevention is a series of conversations that start when we're young and continue as we go through middle and high school and beyond. We have tools that can help you start those conversations.
A fourth and final substance of focus for the coalition is prescription drug misuse.
The collection of student survey data for prescription drug misuse changed in the time between our 2014 and 2016 surveys. So data for this substance tracks trends starting in 2016. Misuse of prescription medications includes prescription opioids and prescription stimulants such as Adderall. Although use rates are reasonably low, prescription drug misuse has always been an area of focus because of the especially high risk of overdose and for developing substance use disorders. You can see that from 2016 to 2021, as a result of community collaboration led by the coalition, We have reduced prescription drug misuse across all grades, with no reported misuse among middle school students in 2021, and high school use rates now below peers nationally.
There is no misuse of prescription drugs reported by 7th and 8th graders, again suggesting that ever important delayed onset of initiation. In addition, uniformly low rates of past month prescription drug misuse, and especially the big reduction in 12th grade compared with our 2018 survey, is noteworthy, given the community's history of tragic loss. And yet, there is still a significant perception gap for high schoolers between perceived use at 38.1% and actual use below 2% among high school teens. In addition, overdose deaths during the first year of the pandemic rose nationally above 100,000 people. Opioids are a factor in 72% of all overdose deaths, including the synthetic opioid fentanyl. And the DEA is reporting a sharp increase in fentanyl-laced fake pills nationally and here in New York State, often purchased by teens through social media platforms. So continued education and efforts are needed in this area. Our local law enforcement partners with state and federal partners to reduce the flow of illicit drugs, including opioids and fentanyl, to the region. Community organizations like Rise Sustainability, our garden clubs, some of our youth sports organizations, and the Scouts have all partnered with the coalition to promote safe disposal of medications. And we do see increases in collection at the police station drop box following drug take-back days. We have substance use treatment and hospital partners who provide monthly naloxone training and free naloxone kits, and partners like Family Navigator Support programs and For Drug Help assist with connecting families who need it with treatment for substance use disorder. Our media partners and our social media platforms are used to provide education and information about the risk of prescription drug misuse and to support and promote safe disposal during our biannual DEA drug take-back days. The Rise City schools also made policy changes to provide naloxone training to all school nurses, and naloxone kits are available in the health offices in the event of overdose crisis.
How will you show up for prevention? You can monitor prescription and over-the-counter medications in your home and keep prescriptions locked up. Free medication lockboxes can be delivered to your doorstep by contacting the coalition at ryactcoalition@gmail.com. Lockboxes are also helpful for students heading off to college to safely store their prescription medications. Dispose of unused or expired medications in ways that are safe for people and for the environment. We have a drop box in the lobby of the Rye Police Station that is available 24 hours a day, 7 days a week, 365 days a year, no questions asked. Rye Act also has deterra bags that safely deactivate small amounts of medications. Contact us for more information. If you are worried about a friend or a loved one who may be using substances, help connect them to treatment. You can find resources on our website. And Rye Act partners offer free, life-saving naloxone training every month in English and in Spanish. Knowing how to use naloxone and keeping a kit available at all times saves lives.
In addition to our 4 substances of focus, we collect survey data and other data about social, emotional, and behavioral health, including risk and protective factors for youth substance use. Risk factors are defined as biological, psychological, family, community, or cultural characteristics that increase the likelihood of substance use. Examples may include living with a family member who has a substance use disorder, other family history of substance use disorder, co-occurring mental illness, family discord or instability, living in poverty, or identifying as part of a historically marginalized group. Protective factors, on the other hand, are characteristics that decrease the likelihood of substance use or that mitigate a risk factor's impact. Many of the same characteristics that can be risk factors can also be protective factors. For example, lack of social or family support and connection experienced by some LGBTQ+ teens can be a risk factor for substance use. But on the converse, with supportive family and community environments, including the environments at school, that can provide a protective factor when present.
Mental, emotional, and behavioral health are interconnected, and that connection works in both directions. Sometimes youth who experience anxiety, depression, or other mental health challenges may turn to substances to self-medicate, and sometimes substance use can lead to mental health challenges. For example, using high-potency marijuana is connected with increases in anxiety, depression, and psychosis. Similar to trends nationally, our 2021 student survey showed a 15% increase in thoughts of suicide among high schoolers and a 25% increase among middle school students. And our peer-to-peer shows that fewer than 25% of students know how to seek mental health help at school if they need it. Key leader data shows that more students than ever before need academic or social emotional support in the wake of the pandemic, with the highest need among our peers who identify in historically marginalized groups. While 79.4% of 9th and 10th graders surveyed said they would talk to a caring adult if a friend were thinking about suicide, less than 60% would seek help for themselves if they had symptoms of depression that lasted more than 2 weeks. While 74% of our RI peers said that their parents set clear rules about substance use, only 55.5% said parents enforce consequences for breaking those rules. About 2/3 of teens say their parents or guardians talk to them about the risks of substances, and only 35% say teachers talk about the risks of drug use. We need help from all the adults in the community in order to make an impact on these risk factors and help protect our mental, emotional, and behavioral health.
The prolonged impact of the COVID-19 pandemic on youth and families is a factor contributing to the increase in reports of suicidal ideation, a 41% increase in reports of depression and anxiety nationally, and the overwhelming need for social emotional support currently happening locally and globally. Despite decreases in youth use rates, the pandemic saw a 13% increase in adult substance use rates, as reported nationally by the CDC, with the highest increases reported among women with children in the home. Youth are expressing heightened concern about global issues, such as the threat of war, school shootings, climate change, persistent racism, anti-Semitism, ableism, and anti-LGBTQ+ sentiment and legislation, along with the political divisiveness surrounding these issues. This is paired with the tragic loss of young lives to suicide and overdose. Those lives are those of children, siblings, family members, friends, classmates, students, and neighbors in our RI community. Our challenge lies in determining how best to support the mental, emotional, and behavioral health of youth and families as we emerge from a global pandemic into a world fraught with so much uncertainty. Even before the pandemic started, this was an area of both concern and collaboration for the coalition and its community partners. Some of the ways we collaborate and will continue to collaborate. Our youth serving sector partner, RI Youth Council, partnered with RIACT and RI High School to pilot the University of Michigan's evidence-based peer-to-peer depression awareness and suicide prevention program at RI High School this year. The program will continue in the 2022-23 school year, including expanding to the RI Middle School. RI Youth Council also partners with the school district for a DBT program for 6th graders and social emotional skills programs in grades 3 and 4 in our elementary schools, and partners with RIACT to provide community training in youth mental health first aid. Civic partners like Pride Community Group offer programs to promote diversity, equity, and inclusion such as Pride Month celebrations, community mural projects, and community conversations. Our houses of worship have partnered with the Coalition and Rye Youth Council to offer youth mental health first aid and community programs around resilience and adverse childhood experiences, or ACEs. Faith-based youth groups partnered with the Youth Coalition and RYAC's Youth Action Team and Rye Youth Council's youth leaders on our 31 Days of Mental Health campaign. Our school district has committed increased resources to social, emotional, and mental health support for students, faculty, and staff. These include things like professional development, such as youth mental health first aid in-service training for teachers. The district also commits resources to support 8th grade health curriculum work, expansion of the academy at Rye High School, and increases in integrated co-teaching. Multiple community partners have been involved in the development of our Parenting in Changing Times newsletters and corresponding community conversations. These have covered such topics as COVID-19 and the return to school, race and racism, and creating a community of belonging to better support LGBTQ+ youth and adults. A 4th volume on disability and ableism is currently planned for the fall. And at the heart of this work, our youth leaders have been involved in mental health science research projects, the 31 Days of Mental Health campaign, the peer-to-peer initiative, just to name a few. So in closing, I echo the question of Daniel, Madeline, and Matthew. How will you show up for prevention? You can recognize the signs and symptoms of an emerging mental health or substance use challenge and how to connect youth to help by registering for an upcoming youth mental health first aid, community, or teacher training. You can check out our Parenting in Changing Times newsletters so that you can learn more about how to support young people in our community and engage in those important conversations. Want to better understand the impact of the pandemic on the mental, emotional, and behavioral health of teens in the community? Check out their 31 Days of Mental Health campaign. Most importantly, start a conversation with the young people in your life today. Help them understand that making the healthy choice not to use substances is part of taking care of their mental and physical health. You can click on our tips and tools for parents and caring adults for suggestions. You can access all of this information, including clickable links to the resources and materials we've mentioned throughout this presentation, to learn more by pointing your phone's camera at the QR code on your screen and following the link. We'll be checking in throughout the 2022-23 school year to see what you're doing. So what's your one thing? How will you show up for prevention?